Joseph Darby. I'm pastor of Morris Brown AME Church in Charleston, South Carolina.
And sir, what sort of problems is your parishioners having with health care?
The classic problems that I've seen in 30-some odd years of ministry, we have a number of people who have great struggles when it comes time for serious care, for critical illness, because they cannot afford the kind of preventive things that would lessen the chances for that critical care. We have a number of older members who struggle sometimes with whether to go to the doctor or whether to pay utility bills and rent and things like that. We've got some younger members of the congregation who are in school and who are looking at grad school and have to wrestle with the fact that they might have to seek their own health insurance because the cutoff age will not take them through grad school. We have had instances where we've helped people with medication expenses because the meds just cost too much.
One instance where a member of your congregation has really suffered because of the way our healthcare system is organized now?
I can. A very old and very honored member of our congregation spent most of her life doing what used to be called domestic work, which is now, I guess, service work. She had a cancer issue a couple of years ago, and we were able to help, but she very nearly went bankrupt because the kind of work she did not afford her health care. She did not have bundles of retirement money, and it got to the point where either we had to step in and try to do something, or she was just going to kind of suffer silently and probably waste away. It's the kind of thing where there needs to be some kind of a net, needs to be some kind of a way of preventing anyone who has worked their whole life and worked hard their whole life from suffering.
Greta Grant Taylor, Morris Brown AME Church. The other issue I particularly had was with the medications that, of course, are prescribed for those who are not insured. And this is particularly with my mom, who recently, had high blood pressure and high cholesterol and was put on a name brand drug, which unfortunately they don't make a generic form for her. So she's, caught with buying 10 pills at a time, and if she doesn't have enough money, then she simply doesn't buy the pills. So at a bare minimum, there should be generic forms, doggone near mandatory, out there for people who cannot afford to pay for name brand drugs.
Reverend, what would you tell a Christian about why this effort is important now?
Well, as a minister in the African and Methodist Episcopal Church, the 24th of our Articles of Religion says that we are to be loyal to and to work to improve the government wherever our church is situated. I think that Christians have an imperative to make their voices heard when it comes to matters of public policy. I think authentic Christians ought not let others hijack that, and that we hammer home the consistent message that goes through Christian scripture, through Jewish scripture, through Muslim scripture, that equitable treatment and fair treatment of our neighbors and reaching out to those who need that kind of a reach from people of faith is essential. I think that when we work towards seeing that government does that, as government should do that, then that's the real work of people of faith.
Very often we hear people like our governor, Mark Sanford, say the churches just need to step up. Why can't they fill this need?
Okay. I think our governor is living in Disneyland when it comes to the idea of churches stepping up and filling that entire need. In the given week, our congregation, which is an urban congregation, gets many requests for assistance, for everything from rental assistance to medication to just food to go on the table. And we've gotten enough since the economy got rough that we have to kind of ration that out. We are not physically able to do that. No church is physically able to do that. I think one of the rightful functions of government is to promote the general welfare. I take that to mean that government has a role in seeing to the wellness, to the health of the citizens. And I don't think that government can pass on that responsibility. I don't think that any amount of health company largesse in working with churches to give away drugs rather than dropping the price of drugs will help. I think there needs to be something done nationally to make sure that that happens. We need the kind of medical Marshall Plan for America that rebuilt Europe after World War II.